Teeth are a genetic gift. Some of us are born with a perfect set, and some of us, not so much. So what do you do when you're missing teeth right in front of your mouth? The case of the week today is of a young man in his 30s that showed up to my office a few years ago and said, I am missing a tooth in the front. I said, let me take a look. I said, smile. And this is what he shows me. What's going on? Technology today is wonderful. I can actually scan somebody's mouth and take a look at a 3D model of what's going on. Let's take a look a little closer here. Our patient was born with 2 large laterals and only 1 central, or maybe there were 2, but the teeth moved in. As you can see, he's in a crossbite. Look at the gum here. It's overgrown, and whoever his dentist was tried to actually build up a tooth inside. You can see that there's a metal bar going across trying to hold this makeshift Maryland bridge. The problem was that it kept breaking right off here and off here. And he kept coming back to my office wanting to get it fixed. Let's look at the x-rays real quick. You can see that right here, he has a plastic tooth, metal wire, and basically teeth glue to hold it all together. This can't last. So what do? Well, the options are very simple. First of all, implants, but how do you place 2 implants in this space? We have something called the incisive canal here. That's where the nerve comes out, so we can't place an implant here, and there's really not enough room. On the other hand, the most correct treatment plan is obviously do orthodontics to expand the upper arch a little bit within limits and create the space for the implants. However, that option is very expensive and requires a lot of time. Our friend here said, Doc, can you fix me so it looks nice so I can function, enjoy my life? We'll worry about the orthodontics later when I can actually afford it and spend the time doing it. I said, okay, let's do something a little bit simpler. What we decided to do is make a conventional bridge with the modification. So as you can see, we went ahead and prepared the teeth. Preparing teeth means cutting them down so we can put a bridge on top. You can see the teeth here prepared and the tissue in between. The problem is that if my technician makes a regular bridge, what they'll do is they'll basically place the bridged area or the pontic over this tissue. And because this tissue is irregular, the bottom of the bridge will be irregular. If that is the case, my patient will never be able to clean underneath, not even my hygienist. Let's modify this so we can create a nicer environment that will not only look better, but function better. Let's take a look at this. My technician actually made me a bridge with ovate pontics. We've discussed this before, one of my favorite topics. Take a look here. These are the pontics. They're rounded, but they won't fit the tissue. So what do? We use a special silicone mold that allows me to position the bridge into the right place. And you can see here what it looks like underneath. And then we go ahead and open up the tissue. I make 1 incision closer to the palate and push all this tissue outwards, just like that. My staff likes to call this the Dr. Zev Kaufman Filet Mignon technique. Take a look how much tissue we managed to bring out here to the facial surface. And we leave this tissue just like that. No suturing, nothing at all. It's solid and it is held by the bridge. And our patient goes home looking just like that. Gorgeous. 2 weeks pass, and this is what he looks like when he presents for a checkup. Look at the keratinized tissue that we got here and look at the volume. It's not perfect as nature intended it to be yet, but let's give it a little time. Let's take the bridge off. Take a look at how beautiful this tissue is. The pontic areas are nice and round. We actually have some papilla reforming and it looks great. We're ready to fabricate the final bridge. Let's take a look at our scan now. You can see the provisionals on the scan. Let's remove them. You can see our beautiful preparations and you can see the beautiful ovate pontics that we created. And if we turn off the color, you can see it even better. My technician is going to smooth all of this to make sure that the pontics are nice and gorgeous. And in order to help my technician visualize what needs to be created, I went ahead and scanned the provisional bridge as a guide as well. Take a look. You can see the rounded ovate pontics and the way the bridge is. It's beautiful. Take a look. My technician managed to duplicate our provisional and create a beautiful final zirconia-based restoration with porcelain baked on top to show some shades and gradations and make it look natural. And this is the other view from the tongue side. And here's a final in place. Our patient was very, very happy. Wouldn't you? As you can see, we got beautiful gum contours. Yes, I'd love to have them perfect, but I'm not God, but I can create a beautiful environment that he can clean. And if he ever wants to put a floss underneath, it'll flow right through on those nice round surfaces. And of course, the obligatory smile. So much better. And a simple procedure, a bridge with ovate pontics. From Prosthodontics and Implant Surgery of Manhattan, where people come in with missing teeth and leave with winning smiles, I am Dr. Zev Kaufman, and this was our case for the week. Happy smiling.